Today, let's talk about fluid dynamic or blood flow theory by Bean and Byrne in 1966. According to this theory, tooth movement occurs as a result of change in the flow of fluids in the periodontal ligament space. Periodontal ligament space is a closed space and the passage of fluid in and out of this space is limited. The periodontal ligament space contains two distinct fluid systems which interact with one another. Intracellular fluid, which consists of cells and periodontal fibers; extracellular fluid, which consists of two primary constituents, intravascular fluid and interstitial fluid system. The interstitial fluid system acts as so-called squeeze film, which acts like a spring and an initial shock absorber or force exerted against a tooth, whether by foot, prosthetic or orthodontic appliance, and dampens the kinetic energy of the mechanical force applied. A greater force of prolonged duration and magnitude, such as applied during orthodontic tooth movement, initially causes the interstitial fluid in the periodontal space to get squeezed out and move towards apex and cervical margins. Thus, the resistance is built up, which results in slowing of the tooth movement. Bean related this behavior of periodontal ligament as squeeze film effect, which is proposed by Hayes in 1961. When applied force is sustained and prolonged or continuous, compression of periodontal ligament occurs on the pressure side, causes the occlusion of the blood vessels, and there will be formation of aneurysms, which in turn in replenishing the film, squeeze films, dissipating the kinetic energy through the vessel wall. Bean suggested that there is an alteration in the chemical environment due to decreased oxygen concentration or level in the compressed areas as compared to tension site, which initiates the release of the chemical messengers that create favorable environment for tooth resorption, and hence tooth movement occurs. Thus, in essence, altered blood flow and the formation of aneurysm causes a blood gas to escape into the interstitial fluid, thereby creating a favorable environment for resorption. Thank you.